Good afternoon, everybody, and welcome to Tuesdays in 10 with Molly. This week we're going to talk about the terminology of end-of-life care, hospice care, and palliative care in particular. Now, I know we often hear these terms and it feels very scary. You would hear that a loved one or friend, someone we know, went onto hospice, and we think, oh my goodness, that's it, right? Not necessarily, and I think it's a very, very important thing to know when we hear the word hospice because it's such a wonderful benefit to experience through someone's end-of-life journey, through your own end-of-life journey. So when someone signs on to hospice, it means that they are meeting specific criteria in which they have 6 months or less for the typical trajectory of the illness that they're diagnosed with. Okay, this does not mean that in 6 months they're going to die, right? It means the typical trajectory of the illness. If someone is diagnosed with cancer or pancreatic cancer, Alzheimer's, any diagnostic that meets the criteria for hospice, that the normal outlook would be 6 months or less of life. Again, this does not mean that mom, dad, whomever has that end date, that definite end date. Okay, so when someone signs on to hospice, typically, statistically speaking, individuals tend to live longer when receiving hospice services than if they hadn't received those hospice services in end of life. And so what that means is that when you are receiving a hospice benefit, whatever company or agency or hospital service provider that you're receiving, but that hospice benefit, all right, you're getting that extra care, that extra TLC, the nurse every week, and this is primarily in the home, the nurse every week, home health aides assisting you in care, wound cleaning, things like that. You might have a music therapist, right? You might have volunteers coming in and helping with socialization skills and life review, reminiscence, end-of-life doulas. All of those are benefits for someone in end-of-life care and receiving hospice care. So that 6-month outlook, it could be more or less depending, but hospice really is for quality of care in the end of life. So by you signing on to that hospice benefit, that doesn't mean that someone's giving up or we're throwing away hope or, that we're setting any kind of timeline or signing a death certificate. And I know that people say that. They're like, oh my goodness, hospice. That's not good. Not necessarily. You always need to look at hospice as that you're increasing the quality of life for the remainder of someone's life when they have that chronic illness, that life-limiting illness. All right? So that's hospice. When someone says palliative care, you don't need to be on hospice to receive palliative care. So palliative care typically, like hospice had that 6-month trajectory, palliative care has typically 2 years, right? But again, that's very open-ended because when you're on palliative care, you can be receiving that comfort care, that additional TLC, pain management interventions while you're still seeking treatment. So you'll hear a lot of people are going through chemo for a cancer diagnosis, right? Cancer support programs. They're actively seeking treatment for their cancer diagnosis, but they're receiving palliative care. All right. So again, that's not saying, okay, well, 2 years and that's it, oh my God, they're on palliative care. Palliative care is another assistive program for pain management, for stress management, family support, caregiver support. You'll hear palliative care programs through cancer support centers and other different diagnoses, right, and their support centers. But you don't have to be on hospice to receive palliative care because within that time period, you might go into remission and no longer have the need to have that active treatment, right? So you come off that palliative care. It doesn't mean you're going on a hospice. It can mean that you've treated your diagnosis or your symptoms. All right, so that's a very big difference. Like I said, you're receiving palliative care when you're on hospice because you're receiving that comfort care, that pain management, stress interventions, breath practice, and work to ease your blood pressure and your breathing, right? But you don't have to be on hospice to receive palliative care. Good? Okay. If you have any questions, you can always comment below or send me an email. But that's a very big discernment on those two, and they're two different benefits. So with our few minutes left, other terms you might hear in regards to end-of-life care are respite, right? So if someone goes on respite, you'll hear that term, especially if someone is on hospice and they're on hospice at home. They might go on to respite, which is a 5-day benefit period where the individual who is on hospice can go to a nursing home, a residential hospice center or facility for up to 5 days, and depending on the insurance, that 5 days is covered. Again, depending on the insurance and depending on the individual's age and benefits, most of the time that respite is covered, but not always. So that's an important thing to know. I've experienced clients and families that put in for their respite benefit and then find out after the fact that their type of insurance didn't cover the respite and they had to pay that room and board and care for that on-site 5 days. So if you're looking at respite for your loved one because they're receiving home hospice, double check with your insurance, and that's a you thing. Double check on your insurance because the hospice or the hospital might not do that for you. So it's important for you to double check your insurance and see what's covered as far as respite. And then there's different hospice coverages too, depending if you're receiving different levels of care for hospice. So that's always something to check into when you're admitting a loved one or yourself onto hospice services, to know what benefits you have covered, how many days, how many hours, in-home care if you went on site, all those questions to kind of look into. So it's not, all of a sudden these bills and these things at a very difficult time in your life anyway, or for your loved one. So it's important to look at all of those. And the last term you might hear is bereavement. And bereavement, I always say, is a fancy word for grief. Bereavement packages, right, or benefits are part of the hospice benefit. So any hospice that you go to has a 13-month hospice benefit, bereavement benefit period. And so that's essentially free of charge once you were on the hospice service. And that's for your family, for yourself, to receive 13 months, up to 13 months of support to help you cope, process, deal with the grief and loss of your loved one. And we do that 13 months so you are able to go through every holiday, every special event up through the anniversary of the death. So we got you for that full year and a month after death for that support. So that's another thing not everybody knows about, that's an included benefit, and it's super important and helpful. Often families will say, okay, well, mom's gone, or we did everything, we followed her wishes, we went through the funeral, I'm done, and that's a relief in itself. But then a couple months down the road, you realize you didn't quite cope with your own grief because you were going in the moment. So when it ended, that was a relief in itself, but that wasn't necessarily you being able to process the loss of your loved one, but a relief that maybe a difficult journey was at an end. So it's important to always check in with your grief. It's not a one and done. It's not in 13 months you're okay, in 6 months you're okay. It's something to always constantly check in with. And so that's another thing to look at in the hospice benefit. You might not want it that first month or second month, but maybe third, fourth, fifth. It'll be really helpful to have that support if it's one-on-one or in a group. Just always important to look at that bereavement service. All right, so I know that was a lot of information this week, and I know I hit a bunch of topics and terms. So again, if you have any questions you know, regarding yourself or your family, or just out of pure curiosity and interest, you can email me at energydancehealing@gmail.com, message me on Instagram or Facebook, and I will see you next week. Thanks so much.